here to tell you about why and how the healthcare delivery system that we have today is going to be virtualized. And this is important to you because if you have a virtualized healthcare delivery system, you can actually bring healthcare to the seniors, as opposed to the seniors have to travel into the healthcare delivery system to get their care. So we know that over the last 150 years, life expectancy has been going up about a year for every 4 to 5 calendar years. But this didn't just happen by chance. This has happened because of the tremendous work that our healthcare professionals and our medical scientists have been doing in order to extend life in this way. But it's coming as a cost, and its cost is actually improved or increased the complexity of the healthcare delivery system. Over the last 50 years, the number of medical subspecialties has increased from 20 to 150, yet the number of clinicians we have per patient is actually decreasing. So we have this challenges, and then we also have the challenge of cost. And we all know this well, that the cost of healthcare is going up unsustainably. And we're trying to solve this problem of how do you provide high quality care to everybody at a low enough cost such that we can keep our economy healthy and our society moving forward effectively. Now, fortunately, there's some new technology on the scene which can really help us. It's a big deal. In fact, the big consulting firms, the Accenture, the Deloitte, the Gartner has said we are in the midst of our fourth industrial revolution. The first one was in the 1700s. That was steam power. The 1800s had electricity. The 1900s had computers. And so this one must be a big deal, given those other three. And it is. It's based on the internet. The internet has enabled cloud computing, Internet of Things, mobile computing, predictive analytics, artificial intelligence, and these things are big deals and they transform industries. This isn't a hypothetical. We are in the midst of these transformations, and these brands you'll all recognize. You'll see the top ones are the ones which are really the darlings today of Wall Street. And you'll see the bottom ones are the ones which have really gone by the wayside. Many of them have actually gone out of business. Others are a shadow of their former selves. And the top ones displaced the bottom ones because they embraced these fourth generation technologies. Healthcare is no different. Healthcare always follows. It is never the first, but it always comes around. And there's as much pressure as ever on these healthcare delivery systems to change and to embrace these fourth generation technologies. If you look at the right sliver about consumerism, our consumers are smarter than ever because they have access to all the information on the internet, and they're able to pick how they want to get their healthcare. If you look at the sliver on the left, you'll see that these very large tech companies are moving their way into healthcare because they see how big of a spend it is, how big a part of the GDP it is, and they're pushing into the healthcare world. And so the healthcare incumbents of today are needing to change, are needing to embrace these fourth generation technologies in order to advance healthcare delivery capabilities such that they can become better, more cost effective. So how does the healthcare delivery system embrace fourth generation technologies in order to improve our healthcare delivery system? And that's using telehealth. If you think about banking, several decades ago, banks came up with the ATMs. And then over the last couple of decades, they've actually put an online banking layer on top of the brick and mortar banking system. And that's what's going to happen in healthcare. In healthcare, we're going to have a virtual care delivery layer on top of the brick and mortar layer. One way to think about how virtual care delivery or telehealth can actually bring healthcare out to the population is actually using telehealth and the benefit of that is illustrated by this picture, where even if you have a clinician who has the best information in his or her mind, but they can only impact and deliver care to those people in their immediate vicinity, you really have a bottleneck. But if you can use virtual care and you can actually enable that clinician to provide care to wherever that patient might be, you can greatly improve the healthcare delivery system. And this is how it looks. This is how it looks where you have a patient who, in this case, has a nurse next to him, and you have a clinician who's actually beamed in and interacting with that patient in order to deliver care. Some of you have maybe even tried this already to date. Now, how does this layer on top of the brick and mortar healthcare system we have? If you think about a healthcare delivery system, it's comprised of many subcomponents, and it's geographically mapped around an area. And all the red dots are actually part of the healthcare delivery system. They might be hospitals, they might be clinics, they might be physician offices, they might be labs, and they're spaced inter and amongst the community in which we live, in which there's people's homes, and there's also senior living. And the health system has these experts who are distributed throughout their healthcare system. And as I said earlier, today we have 150 different subspecialists. So they're really scattered all over the place. Now, what if you could actually enable that healthcare delivery system to leverage their experts wherever they might be, and you beam them to the patient wherever they might be in order to deliver the care when and where that patient wants. This is how the health systems are thinking today. And then if you have a virtualized care delivery system, you can actually now start thinking of enabling your healthcare delivery system to not only reach outside your city, perhaps even outside your state, perhaps across the country, and some of the bigger brands are starting to think about, how do I actually deliver care even to other countries? Now at InTouch Health, where I am, we have about 450 health systems and about 3,000 hospitals where we can take any of those clinicians and project them into wherever their expertise may be necessary. Now, if you think about senior living, you might think, oh, well, this is great for the young folks, but perhaps it doesn't work so well for the older folks because they're not going to be interested in a technology solution. And that turns out not to be true. This is one paper of many, which is in the International Journal of Emergency Medicine just recently, where it basically says that older people are just as apt to adopt this kind of technology as younger people. And then this article just came out in Political just a couple of weeks ago. It says that, it first says that telemedicine can be used to keep older patients out of the hospital, so why hasn't it taken off? And it also says the reason it hasn't taken off is because of these regulatory and reimbursement barriers which have prevented it from taking off. Now, I've been in the telehealth field now for 17 years. I was on the board of the American Telemedicine Association for 7, and I've watched this progression of regulatory and reimbursement change. And I can tell you that we're in an inflection point right now. Just in the last year, 40 congressional bills have passed or are in this process of becoming passed to enable telemedicine to be used for this wide range of applications, whether it's behavioral health, COPD, congestive heart failure, the veterans, etc. And then this is an act which is supposed to be, my lobbyist says this is probably going to pass this year. It stands for reducing unnecessary senior hospitalizations. This bill is intended to pass this year. It says that CMS reimbursement will go to SNFs and senior living for technology because they say 45% of transfers from the senior living facility into the hospital turn out to be unnecessary. And then in other regulatory, spaces like in Medicare Advantage, in remote patient monitoring, in fee-for-service Medicare, in bundled payments, and then finally in readmission reductions. In the readmission side, which is already in place, it's showing that if you have too many readmits from your senior facility back into the hospital, you become penalized. But then if you actually have a low number of readmits, you can actually benefit financially from these situations. So the point is that now's the time in which you can link your senior living facilities with healthcare systems in partnership with financial business models that work. Now, having said all that, and forgetting about the financial benefits, doesn't it make sense for your seniors to be able to get care in the most convenient and comfortable place that they exist, which is perhaps at their home? Or wouldn't it make sense if you need a little higher end treatment to place something like a telemedicine kiosk into the actual facility so that you can actually get a heart or lung checked, or you can actually get the different types of vital signs checked while still in your senior living facility? I think these are opportunities which can exist today. They perhaps couldn't have existed yesterday, but they are the way that we should be moving into the future. And to let me end with this quote by Alan Kay, who's the inventor of the Macintosh computer, who we will all remember, is the best way to predict the future is to invent it. Thank you very much.